Mental health care is supposed to be a place of safety and dignity, so the idea of patients losing their beds because of a rat infestation is as shocking as it is upsetting. But this story is about more than pests in one building. It taps into a much bigger question about how seriously a community treats mental health care, especially when services are already stretched. A 12-bed public inpatient mental health unit in southern Tasmania, located within Hobart's Peacock Centre and known as Peacock House, has been temporarily closed after a rat problem was identified earlier this month. The broader Peacock Centre complex is still operating, but the specific inpatient beds at Peacock House have been taken offline while the issue is dealt with. Health authorities say they moved quickly once the rodent issue was detected, launching industrial-level cleaning and professional pest control to tackle the problem thoroughly rather than patching it up. During the closure, people who would normally receive care at Peacock House are being supported through other mental health services that are considered clinically appropriate for their needs. Staff who usually work in the closed unit are not being stood down. Instead, they're being reassigned to other acute mental health services in southern Tasmania so that their skills remain in use, where they are still urgently needed. The health department has also brought in WorkSafe Tasmania, an occupational hygienist, and facilities management experts to advise on what remedial work is required to make the environment safe again and to prevent the problem recurring. That kind of multi-agency involvement suggests officials are aware that both patient safety and workplace safety are under scrutiny, and rightly so. The wider Peacock Centre houses other key services, including Safe Haven, which supports people experiencing suicidal thoughts or severe mental distress, and the Mental Health Integration Hub, which helps people connect with ongoing support. These services are continuing to operate as normal, despite the closure of Peacock House, and authorities say the inpatient unit will reopen as soon as it is genuinely safe and appropriate to do so. But here's where it gets controversial. When a system is already under pressure, even a temporary loss of beds can feel like a huge blow to people who are desperate for timely, local care. The Peacock Centre itself has had a difficult recent history. Over the past decade, the North Hobart site has been seriously damaged by two separate fires. In 2016, a 54-year-old man was convicted of arson after setting fire to the center's reception area, forcing major repairs and rebuilding. Then, while the heritage-listed building was still in the process of being restored, another deliberately lit fire on Christmas Eve in 2021 caused further damage and disruption. For people who rely on the Peacock Centre, it can seem like this crucial mental health hub has been hit by one setback after another, and now a rodent infestation has added yet another hurdle. Despite all this, mental health advocates remain determined to keep services accessible. Tash Smith, Chief Executive of Mental Health Lived Experience Tasmania, told ABC Mornings that she is confident people will still be able to find support during the closure period. At the same time, she stressed that Peacock House is a vital service and must return to full operation as soon as possible, reflecting years of advocacy to get exactly this kind of service in place. She also highlighted the importance of remembering the other supports offered at the Peacock Centre, such as Safe Haven and the Integration Centre, and pointed out that bringing all these services together in a non-clinical, more welcoming environment is critical for people who may be intimidated by traditional hospital settings. Smith encouraged anyone needing help to reach out to the Access Mental Health Phoneline on 1-800-332-388, which serves as a key gateway into Tasmania's mental health system. For someone in crisis, knowing there is a single phone number to call can be the difference between feeling abandoned and feeling that help is still within reach, even when a particular facility is temporarily unavailable. This kind of reminder is especially important when stories like this might otherwise leave people thinking that support has simply vanished. Zooming out, the closure of Peacock House is happening against a backdrop of broader strain on Tasmania's mental health bed capacity. In recent years, dedicated mental health services across the state have been under increasing pressure, with both public and private providers facing financial, regulatory, and infrastructure challenges. And this is the part most people miss. The rat infestation isn't an isolated drama. It lands on top of an already fragile system that has been losing beds faster than it can replace them. In 2023, St. Helen's private hospital in Hobart closed after its operator, HealthScope, said it could no longer afford to maintain the hospital's heritage building. St. Helens provided 31 inpatient mental health beds, as well as an 8-bed mother and baby unit that supported women dealing with sleep issues and postnatal mental health concerns. The hospital also cared for people experiencing problems related to alcohol and other drugs, making its closure a major loss across several areas of specialist mental health care. More recently, the Hobart Clinic in Rokeby, a 27-bed private mental health facility and the last remaining private inpatient option in southern Tasmania, was forced to shut its doors temporarily for 17 days because of financial difficulties. Reports indicated that the clinic had also failed to meet a key requirement during a regulatory audit, adding another layer of complexity to its future. A 6-month financial reprieve from the state government has kept the clinic open for now, and clinicians are working on a longer-term plan to secure the service, but the situation highlights how precarious mental health infrastructure can be when it depends on fragile funding and compliance conditions. All of this raises uncomfortable questions that many people may disagree on. Should a heritage building or budget limitations ever be allowed to outweigh the urgent need for mental health beds? Is the system doing enough to prevent crises like infestations, fires, and financial collapses in the first place, or are authorities mostly reacting once things go wrong? Some might argue that closing a unit until it is completely safe is the only responsible choice, while others might feel that repeated disruptions show a deeper failure to prioritize mental health on par with physical health. So, what do you think? Is Tasmania's mental health system doing the best it can in tough circumstances? Or do closures like Peacock House, St. Helens, and the Hobart Clinic reveal a system that is dangerously underprepared and underfunded? Should communities accept temporary shutdowns as a necessary safety measure, or demand stronger safeguards and investment so that essential services are never put at risk by rodents, fires, or finances in the first place? Share whether you agree, disagree, or see another angle altogether, and what changes you believe are urgently needed.